guest is Roy Smith, and Roy is going to talk to us about something that a lot of people probably aren't familiar with. You hear about Medicare, Medicaid, but this is a dual special needs plan, or DSNP for short. Okay, so Roy, educate us. Tell me about this and who it really benefits, who's eligible for this program.
Okay, a dual special needs plan, or DSNP for short, is a Medicare Advantage plan that provides health benefits for those who are dually qualified, meaning that they are enrolled in Medicare and they are entitled to full Medicaid support.
All right. Are there a lot of Tennesseans who fall into that category? How many of our people qualify?
In Tennessee, there's roughly 260,000 people who are dual eligible in Tennessee. And of those, about 102,000 are currently enrolled in the Medicare Advantage DSNP plan.
Okay, so a lot of people are not taking advantage of the plan, is what you're saying.
Yes.
Why is that? Why are they not aware of it? Or
Amy, I think a lot of times people are not aware of it, or they may think it's too good to be true, the extra benefits that they're entitled to.
Okay, so how do you reach them besides programs like this? How do you get to that population, and who are they?
Well, who are they first? Let's start with that.
Yes.
These are generally going to be people who are entitled to Medicare, so they are either 65 and older, or they qualify for Medicare because they have a disability.
Disability, all right.
Correct.
Okay.
And then they're generally of low income, so they're entitled to the full Medicaid benefits. And so for us to reach that population, we have to go out into the community and meet them where they live.
So community outreach is critical.
Community outreach is very critical.
So you're talking door to door? I mean, or events at libraries or wherever, public places?
We work within the community to make ourselves available. We try to do as much education and outreach as possible so that people can understand what is available to them.
Is it more of a rural issue, urban issue? Is it both?
It is actually both.
It's both.
The dual population, some people think of as being primarily just older people, let's say, because of the Medicare component, but roughly 60% of our members are actually under the age of 65. Many of them may have a pre-existing intellectual disability or developmental disability, perhaps they have behavioral health needs and so forth, and so we're able to work with those individuals to provide a coordinated level of care that generally provides greater health outcomes.
Okay, so give me an example. You said a lot of these people think this is too good to be true. This cannot be real. So what are some of the services that you provide that people can't believe they can get these?
Well, by law, all DSNP plans have to cover everything that is covered by original Medicare.
Okay.
So that's your Medicare Part A, which is hospitalization, Part B, which is your physician services and durable medical equipment and so forth.
Okay.
And then these plans also, most of them will include your prescription drug benefits, which is Medicare Part D. But in addition to those benefits, they offer benefits such as dental, vision, hearing, transportation, over-the-counter benefit, even some plans have gym memberships.
Oh my goodness, I'm reading on the screen. Let me, if they'll keep that up for a second. No monthly premium.
No monthly premium.
Coordinated care and support.
And let me talk briefly to that.
Okay.
Because of all the benefits, Amy, I think that's the most critical. These plans will provide a level of coordination between the Medicare benefits that the person is entitled to and their full Medicaid benefits that they're entitled to. So they don't have to navigate the healthcare system on their own. The health plan will reach out to make sure that all the providers that are treating this particular member, let's say, that they're communicating with one another. So that could be a primary care physician, it could be a specialist, it could be a behavioral health practitioner, it could be a pharmacist, it could be a caseworker. The idea is to get them all communicating and working on an individualized care plan on behalf of that member that caters to the specific needs of that member. The result of that care plan is generally better health outcomes.
Sure.
And that results in cost savings. And the insurance plans can then take those cost savings and roll them back into the plan for extra benefits.
That is tremendous. And I also was thinking as you were saying this, you know, it's a maze. Healthcare can be a maze for those of us who don't qualify for those programs you've just mentioned. But if you find yourself in that position, I mean, to have all of that coordination is a beautiful thing and really helpful.
I often will tell people that usually when it comes to navigating the healthcare system, it usually falls on the spouse, and if the spouse isn't available, it falls on the oldest daughter.
Yes.
And then if it's not the oldest daughter, it's the daughter-in-law. They'll go through the ladies before they go to the sons.
Yeah, I think that's true in many cases. And the transportation is a big element too.
Transportation,
these
plans, most of these plans do offer transportation. So whether it's taking someone to their doctor or to the pharmacy for their prescription drugs.
Yeah. Oh, this is tremendous information. Where can people apply for this then?
When can
where?
they?
Or when? I'm sorry, when? I meant when. Is there a time?
There have been some changes in that. In previous years, people who were qualified for D-SNP plans could make plan changes all year long. That has changed for 2019.
Okay.
Starting in 2019, D-SNP eligible members will be using the annual election period, AEP, which runs from October 15th through December 7th, just like every other Medicare beneficiary.
All right.
In addition, new this year in 2019, there is what's called OEP, or Open Enrollment Period, which runs from January 1st through March 31st.
Great.
And then they will have 3 other special election periods that they can utilize. One for quarter 1, one for quarter 2, and one for quarter 3.
Okay, great. We need to wrap up, but thank you for really important information for a big part of our state.
You're most certainly welcome.
Thank you so much. Thanks for coming in. And we'll be back with a lot more right after this.